I'm looking forward to the next Global Health Education Initiative. We are tackling the topic of the heart. For too long, the pharmaceutical industry has dumbed down our education as physicians to a story of cholesterol, and we have in fact demonized this small nutrient in our bloodstream that we would call LDL cholesterol. And this LDL cholesterol, which is manufactured by the liver, is a profound anti-inflammatory. It's one of the primary mechanisms by which you prevent cardiovascular disease. But extraordinarily, somehow we got that story upside down and backwards and created a narrative of a chemical dependence on statin drugs to prevent and perhaps modify the course of chronic disease in the realm of heart and vascular disease. It is this effort that we're going to begin at, but I'm very excited to not just untangle the biochemistry of it, but also start to look into the missed opportunity we have in Western medicine to understand the emotional and spiritual context behind the advent of cardiovascular disease, whether it be heart disease or cerebral vascular disease in the form of strokes. The emotional, spiritual aspects that lead to the stressors that will then go on to form these patterns of chronic injury and failed injury repair are actually really predictable, and we get to see the macro versions of this unfold in clinic every day. And yet the Western medicine paradigm is always focused in on that lab draw and the blood chemistry and what is that LDL cholesterol, and perhaps if you've got a holistically minded doctor, they've included the topic of the HDL cholesterol, which has been termed your good cholesterol. But in fact, the HDL is simply a recycling mechanism for LDL, which again, it just speaks to this failure of understanding of the greater narrative of biology around heart disease. But it also speaks to something about the regenerative nature of human health. And so as we tackle the topic of heart, I think we're going to get to see something about the way in which the human body and biology as a whole was designed forever to be a regenerative, adaptive, and always striving for biology at its prime. We are excited to share this broader spectrum of insights with you. It's going to be an exciting time for us to dive into the topic of heart disease from multiple different angles and include you in a journey that's going to take you into an understanding of not just the heart, but perhaps the heart-mind connection and perhaps the gut-heart-mind connection and how all of those tie together. I'm excited for this time together because every time it sharpens and refines our knowledge base on how we were integrated into nature in our design and how we have so separated ourselves from that in our management of chronic disease. We have an opportunity to shake off our codependence of chemicals and start to reintegrate into the nature in which we were created. And so join me for the Global Health Education Summit this month on the heart.